Let me fix my nose over here because I'm fogging. Don't usually wear a mask in the car, but you guys are in here, so try and keep you guys comfy. Today, I'm one of the critical care physicians covering one of the pop-up intensive care units for taking care of COVID-19 patients. You know, it went from primarily being a trauma surgeon and doing some critical care to becoming a critical care physician all the time and almost never doing any trauma. Car accidents, they're all gone. No one's out on the roads. And the gunshot wounds, they're gone as well. I guess everyone's social distancing. All that seems to come in through the ER is COVID-19 patients.
What do you keep in the trunk of your car, and why do you need to wear this?
Well, I mean, I kind of have a little bit of a go bag back there. I keep a gas mask back there. And I tossed the gas mask in as this whole COVID-19 thing began. And I haven't taken it out of the trunk or brought it into the hospital because I don't want to scare everybody. I actually keep it fresh in the plastic, so when it comes out, it's good and ready to go. I'm not putting it on, but...
Feels like war, it really does. When you're battling every day and not knowing what you're walking into, so that's the part, it does feel like a war. When this pandemic started, we were the first ICU to have our first COVID patient, and then we started getting more and more and more patients and opening up more and more ICUs. I've been in this health system for about 20 years, and I've worked critical care for pretty much my whole career, and this is unbelievable, something you can never imagine. People are so sick.
So we're in one of the COVID ICUs, and behind me they're doing a tracheostomy. By the bedside. We do a lot of tracheostomy by the bedside to prevent people going down to the ORs.
So I started the selfie diaries when someone had asked me to, you know, kind of do a day in a life.
It's about 4:45 in the morning. I'm about to walk in the hospital. This will be my last time for the next 13 hours with no mask on.
And then I continued on doing them, even not needing it for any media, or I continue on just to see what I've been doing. And I kind of actually look back to where we were 2 weeks ago and see all the patients we took care of and how we're closing units now, which is a great thing. And I'll scroll back to show people, look what we went through. And it's a terrible nightmare, but it's good to have the footage that I see what we went through every day.
I have some tears and crying right now because I'm so tired. But now I'm gonna continue on and powering through.
There is a lot of helpless moments because you feel terrible because we're used to saving lives and wanting to save lives. This is a different take. We're helpless because there's no cure.
We just got 6 new admissions.
We know what the data says out there and the best practice, but then the best practice changes every day. So there is a lot of helpless moments because we want to do great work, and I feel like we are doing great work with what we have.
Oh, I hear bells overhead. That means somebody's being discharged from the hospital. That always gets us very excited.
Morning, Matt. The big change is what I do every morning when I get here. You know, I wear typically black scrubs, which identifies me as a trauma surgeon to the staff. And now when I walk into this place, I take a pair of blue scrubs, which is usually meant for just use in the operating room, and I change into that. I put on an N95 mask, and I cover it with a surgical mask. And then I put on a blue cover-up instead of my white coat. How many are we at today?
9.
9. Okay. 1 bed open. Anything interesting happened overnight?
No.
Good.
Everybody's stable.
Good. You know, watching a whole bunch of people go septic at the same time is tough, and it makes you work, you know, real hard to try and keep people alive. But this is the job of trauma and critical care. You get the sickest of the sick, and you work on them until they're not sick anymore. I was a civilian living in Manhattan on 9/11. I had just stopped working at St. Vincent's Hospital, and I was home from work that day. And my wife calls me up and says, turn on the TV. A small plane just hit one of the Twin Towers. And I turn it on, and there's a second plane going in and crashing into the tower. And I said to her, it's, you know, not an accident. This is a terrorist attack. Tossed a bag over my shoulder and headed downtown for the next week. And the more time I spent down there, the angrier I got. I got angry enough to join the Army. I'm a standard TPU reservist. I go away on deployments about every 2.5 years. I was in Kuwait as the command surgeon for the 452nd Combat Support Hospital, and then forward into Afghanistan as a trauma surgeon.
I lived through 9/11. This is just a different kind of disaster. And anything we could do to help New York is why we were here.
Okay, good morning, everyone. To the 3 sites we have today are Good Samaritan, Lenox Hill, and Wyckoff. We've already identified the providers from the Army and the Navy that are going to go out.
At Javits Center, we have the largest incident command in the country, and all these doctors and nurses from the military came together so that we can deploy them into our communities and save lives.
We understood the nature of the disease. We understood the nature of how hospitals run. We got very, very involved in actually running the Javits Center, the clinical part of it, in collaboration, and also involved with the comfort.
Michael Dowling asked that we come here on the request of the governor to assist with helping to identify the appropriate patients that could come into Javits safely. We plan our day starting with a huddle in the morning to understand how many patients do we think we're going to get in, how many do we anticipate discharges. All right, we are all on track today to deal with length of stay. Dr. Langer.
We got the bags you ordered downstairs. You know, the military has provided terrific human beings here who aren't necessarily specifically trained like I was on COVID. And I think these guys come to work, they do their job, they just get it done, figure out how to look at the chest x-ray on the machine, get the labs from some crazy place. I'd say just, you know, MacGyver everything. And this whole experience has just been breathtakingly gratifying.
What this mission is really fulfillment of what we do as medical officers in the Navy. Our job is to respond to whoever needs us, whether that's peacetime humanitarian, peacetime disaster relief, or wartime. I mean, this is what Navy doctors generally signed up to do, is to help around the country and around the world.
We've had collaborations with the military before, prior to this, so this is not new. So we've been working side by side with the military for the past couple of years and have done amazing events here in New York with them. So in many ways, this was an extension of that effort.
I think the Admiral said it best, it's a mission of a lifetime.
So yeah, you know, I usually give myself an hour and 15 minutes to get myself up, dressed, out of the house, and to work. I'm just waiting for these bagels to toast. Usually there's a bag that's usually packed and ready to go. My name's Aaron Mindell. I'm a paramedic at Lenox Hill Hospital. I grew up here, went to elementary school at PS 41. Smoked salmon, cream cheese, and we got smoked salmon, double dose. I look at the first responders in New York City, the NYPD, fire department in New York, and then the emergency medical services. The way we've seen soldiers come out, the comfort. We're kind of like a trident. You know, we all come together to handle a given emergency. Some of the men and women I've worked with out here in the 911 system have decades of experience and have worked 9/11, the AIDS epidemic, the crack wars. I mean, you learn a lot from them. It feels like during this pandemic and during New York City's darkest hours, people finally have seen the level of risk that we've always been faced with in responding to medical emergencies. There's a lot of fear. There's fear during this coronavirus pandemic of going to a place that's normally able to help. And it's not that the hospital isn't able to help, but when there's so many people that need help at the same time, it becomes difficult.
You're needed for sedation, 10
It's a real challenge. It has been extremely trying and difficult for everyone. Almost everyone's lost someone or knows someone who has been very sick. People have heard about several fire department members who are sick and fighting this. I've had several colleagues at work just tap out for a couple weeks and then come back, and one of my colleagues lost 25 pounds. They've been people, everybody's been battling this. So it's not just, civilians or, the inhabitants of the city, but the people that are responding to this and working on the front lines are going down and taking a hit. And you're sitting in the truck, your partner's like, my mom's sick. That's sobering for sure,
There has been nothing typical about our days since March 7th, when we first had our first COVID patient here. It's been crisis management from the get-go. The lows are tough. It's very sad and it's very scary. The highs come with the wins. Every patient that comes off a ventilator, every patient that goes home safely is an up moment. And the way that the staff feels is really that up moment. So when the patients come up to the emergency room, our staff in the emergency room doesn't necessarily know what happens. We have something called hope huddles. So when they have successes, the nurses from those other units go down and say, your patient was extubated, we saved a life, they went home. And to see that collaboration is those are the moments.
So I just want to share, we're 7 weeks into this now. And we've been through, all of us have been through a lot, and now we're starting to see the other side. So we've had 1,055 patients admitted COVID positive, and we've discharged 869 of those patients to date.
Wow.
So
that's amazing. That's really
I think,
amazing. We hear all the codes all day long, and truly there's a lot of really good going on here at Lenox Hill. So I started the Hope Huddle about 7 weeks ago. I was on a late night text chain with some of the emergency room nurses here, and they were telling me just how upset they are. And these are ER nurses. They see everything in New York City come in through their doors. And they were telling me how some of them were crying for the first time they had ever cried being a nurse. And then meanwhile, I'm working the floors and I'm seeing some of the positive outcomes that we're having. I'm seeing people come off the ventilator. I'm seeing people go home. I'm seeing people being able to reunite with their family. So I wanted to start a way to get that information from the floors back down to the emergency room. So I started a thing called Hope Huddles. At change of shift, you gather the staff and you briefly go over the positive outcomes that we've had the past day or two to show them that all their hard efforts aren't for nothing, that they are actually saving lives every single day.
yesterday we discharged 27 and we only admitted 20. So spread the word, bring the data back to your teams, and let everybody know what an unbelievable, amazing job is being done here. So thank you.
All spread a little hope.
Starting these hope huddles and bringing positive information back to the group has really been so uplifting, I think, for the entire hospital.
It's, what keeps the morale high. It brings us together as a community so we can share the good outcomes. And, it's just what we need right now. We need to, even if it's for a minute, it's really important in a time like this.
Hey, let's do this. Let's do that kind right there. We'll bring that on, and then we'll bring that one Cliff Bar. That makes it easy.
My name's Cole Riley. I'm the head of Founders Give. And what we're doing, we're rallying food and beverage brands across the country to donate their products, their yogurts, their cold brew, their hummus cups to New York City hospitals. We've set up logistics centers. We've got freighters all across New York where we're storing product, we're delivering it to these hospitals, and we're the primary distributor of snacks and drinks to the healthcare workers across the city.
Go down to Hall Street, and then Woodhull, that is right there, 2 minutes away.
What I was doing right before, I was launching a media company here in New York, and I was working with a bunch of small, medium-sized independent food brands across Brooklyn. And that's where I started to see, at that lower level, trouble and problem getting their products into hospitals. It started off as just rallying these local Brooklyn brands, thinking, hey, 20,000 units, what does that even mean, 20,000 kombuchas? Like, that's an insane number. But it's been 5 weeks now, and we're at 2 million products collected from not only some of those smaller brands across New York, but some of the biggest food companies across the country. See these doctors excited over something as simple as a granola bar, but it's extremely important when you look at their day-to-day, what they're doing. That granola bar means a lot to them. Yeah, so right now what we're doing, we are loading up 2 trucks and we're sending them out 1 to 2 hospitals with 12 pallets, probably 40, 50,000 units. And then we got another truck just going to 1 hospital, 12 pallets, all 50,000 for them. And it's just a nice controlled chaos.
So currently I'm sitting at one of the nurses' stations, giving a patient some medication and watching him to try to get him off the ventilator. He's weaning beautifully. The nurse Barbara next to me is actually going to give him some steroids, so hopefully will improve success of maintaining and being off the ventilator.
Camera crews here. Hide your liquor, hide your cigarettes. At Northwell, just like most of our hospital facilities switched to being essentially COVID-19 hospitals, the laboratory is now switching over to be a COVID-19 testing laboratory. This core laboratory serves the 23 sites of the Northwell Health Hospital System. We also serve as the core laboratory for the New York City Health and Hospital System. Whatever testing can't be done in those hospitals, we can centralize that testing at the core laboratory here. To give you an idea of the size of this place, we do about 25 million tests every year. Come this way. We're getting clinical tests up and running that were literally just developed in the last month. When I began my training in the mid and late 80s and early 90s, that was in the height of the AIDS epidemic, and that's the last time anybody in the lab industry can remember, validating tests and launching them clinically at the same time like we're doing now.
One of the things that happens in a crisis, as has been demonstrated through history, is when you're in the middle of a crisis, you become unbelievably creative and innovative. So things that you didn't think you could do prior to a crisis, you end up figuring out how to do it and do it quickly during a crisis.
We've got a lot of machines in the laboratory that are capable of doing antibody testing. It's a very common technique that's used in the laboratory for all sorts of other types of testing. So many of the machines we have here can be converted to doing COVID-19 antibody testing, and we're in the process of doing that right now. Some of these machines will be dedicated to running the COVID-19 testing, again, in a fully automated fashion so we can do the maximum throughput. The COVID antibody testing is very important because what it allows us to do is go back in time and see which people may have had the COVID-19 infection in the past. The PCR diagnostic test really only applies to that specific moment when the test is taken and you're identifying whether someone has evidence of the virus at that exact time. With the antibody test, by checking your blood and seeing if you've developed the antibodies to the COVID-19 virus, that's evidence that you had the infection and that you recovered from it. So it allows us to tell if you ever had the infection, and most importantly, we're very hopeful that it tells us something about your immunity in this season to getting the COVID-19 infection again. We're launching the antibody testing on 70,000 of our Northwell healthcare employees. And one of the reasons we want to do that first is because healthcare employees are very willing to share their clinical information and reach back to us. If any of them have antibodies and develop a further COVID-19 infection, we'll know about it.
I know a bunch of us got tested in my unit. The people that were symptomatic, that were home and out with COVID, they all had immunity. And all of us that didn't have the virus, none of us had immunity. So I think it was pretty telltale that it seems like it's accurate. I just figured some of us that are there, a lot of us, a lot of the nurses, we feel that we've been there every day. We should somehow get some kind of immunity, but we don't.
Here we have freshly cured nasopharyngeal swabs. At this lab here, we've been working to create nasopharyngeal swabs in order to assist with the diagnostic testing. The mission statement of the lab has changed from providing assistance to clinical care for our surgeons to whatever we can do to help with the COVID outbreak. Trying to get everything tested, verified, and produced in a rapid turnaround is extremely stressful. To date, our largest project has been producing 25,000 swabs a week. So we have a special curing rack to hang them upside down as they get blasted with UV light. And now we get to do the fun part of going through these one by one to make sure that they meet our quality check. We check to make sure that they're not curved and put in headphones and go to town.
What we've been doing for the past 4 or 5 weeks is rallying the entire food and beverage community to donate their products to NYC frontline healthcare workers.
Yeah, we got another 25,000 units coming into Lenox Hill, so this is our 4th delivery. We're looking at maybe 100,000 units to the doctors and healthcare staff at Lenox. It's pretty insane.
There's been so much that has happened in the last 2 months, 6 weeks. And one thing that became clear is we were going to have a lot of people working very long hours under very challenging conditions, and we wanted to do everything we could as non-clinical support here to help them. And so we were able to set up an area in our cafeteria that we named the Comfort Corner. And it's where we put everything out. Everything is free. Thank you. Thank you, guys. And we said, take as much of anything here that you want. It's all free. Obviously, people always love free stuff, but especially coming down from the floors where the work is very hard. And so I think it was like a huge, enjoyable break for them.
It's wonderful. Folks told us that there's food and things that will really make the employees feel really welcome and thanking us for what we do here. And I think the staff really appreciates that they're appreciated.
When you know that you can brighten up someone's day, fuel them for that extra 2 or 3 hours with just like a yogurt cup or a Kind bar, it feels really good, especially when you're talking about the doctors, the healthcare workers, the staff. Yeah, no, emotionally, it feels really great to be able to give back to those that are helping so many other people.
Thanks for your hard work. Really appreciate it. All right, good choice. Thank you so much. Have a good day. Thanks for what you're doing. Help yourself. Appreciate the hard work. We've had this community truck for a year. It's been so much fun driving around our community and having ice cream for them. So we thought, what a great opportunity for us to bring it out to those making the most sacrifices right now during the crisis and give away some free ice creams.
Hi, the ladies in blue, I love it.
And we're coming out here 1 hospital per day. Get some rest if you can. We also bagged about 70,000 pounds of food at our Stuytown pantry, and there's a lot of folks who could really use that right now. Hey, Veronica, good to see you.
Good to see you.
Come on down. The city and the nation is going through a tough time right now, and anyone that can make a contribution, help support those that are making the biggest sacrifices, I guess it's the least that we could do. That's what it's all about, good neighbors.
So it's about 6 p.m. and I'm leaving the ICU now. About to head home, going to the scrub machine to change my scrubs.
Dirty COVID scrubs.
And go home.
My day was long, but it was okay. It was another day. Another day in COVID paradise. We call it Camp COVID. Try to make the best of it, but it was okay. We did obviously have a few deaths, Some people affect you more than others, but you build a lot of relationships with these people. All our patients are on the ventilator. So we always make sure that as providers, we talk to the patient's family at least once a day, because you have to be the patient's family. So you're trying to give them all the information over the phone and show them that we love their loved one and we're doing everything possible, even though they're not there. My husband is in the medical profession, so I could talk to him about things. Once I see my kids, everything gets washed away for a little while at least. But I feel bad for the kids because I'm so tired when I go home. So I see them, I run straight you'll see I wash up, I run straight in the shower. Best feeling ever, pulling into my driveway. And then I eat dinner, and then I literally pass out. I haven't put my kids to bed in a very long time because I passed right out. And so I haven't put my little one, I used to put it to bed every night, and I haven't done that in a long time. That's very horrible. The first thing I do is take off my shoes. I leave them by my front door, ready to go for the next day. Then I go walk around to my backyard. Hey, princess! How was your day?
Good.
Good, how was school?
Good.
And I have a little station set up in my backyard that has Purell to wash my hands. I wipe down my ID, and I put it in my bag for the next day. I wipe down my car keys. And then I Clorox wipe my steering wheel and my seat of my car. It's just maybe overkill, but whatever it is, it's working, so I'm gonna continue to do it. So I don't bring anything home to get my family sick, my kids sick, bring anything into the house that they can potentially touch and contaminate and get sick.
I am Nicole Russell, co-founder and executive director of the Precious Dreams Foundation. We provide comfort items to help the children in foster care and homeless shelters get a good night's sleep. Can you pass me 5 more bags?
Yeah.
Life for the children that we serve has been hard. It really has. They are literally stuck in place. Some of these kids are sheltering in one room at the shelter with 3 to 5 other people. It'll show you like what's in here. So there's 2 gender neutral bags. And then there's girl bags and boy bags. These are all for teams.
Yeah.
Every single child receives a comfort bag with 4 to 5 brand new good quality items, a book, a journal, sometimes therapy dough. Sometimes they get fidget spinners, things to kind of like just help them self-soothe. Everything that goes into the comfort bag is something that the kids can hold on to when they're feeling any type of negative emotion. It is the person that they wish they could hold, but it's a bear. We put in one of the beige teddies and the black socks. My life has been turned completely upside down from COVID. If someone would have told me at the top of the year that all of this was going to happen, there's no way that I would believe it. This has hit me so hard. It hit my entire family. My dad, my stepmom, my uncle, my aunt, and my neighbor all had COVID. My aunt passed, my neighbor passed, and my dad came really close to not making it. So it's been tough. It's been really tough. Between every single call that I made to the hospital, I was journaling because I had to. Like, if I didn't, I was gonna end up bottling up all of this stuff. I needed to find the balance of like helping myself and keeping myself together so that I could continue this work and focus on our kids. So this one needs a teen book because this will be a gender neutral. This has changed everything for us. We cannot interact with the children. We cannot host our events and do programming for them. It's changed the entire way that we operate, but at least at a minimum, we can still give them comfort items.
It definitely feels a big need. Sometimes, in this position, they don't have a lot of access to certain things. So, to get a nice pair of pajamas or a journal, that stuff helps. Helps them cope and helps them build a little stronger sense of, they can get through this.
Knowing that tonight these kids will have something to hold, or even just like the books, having the books to read, that's probably the thing that gives me hope, knowing that like, we're still in a position to make a difference and help these kids.
requested for the sick fever call, Columbus Avenue and 100 Street.
That's the call type, the COVID call type. Sick fever cough. The thing with COVID is that you can't see it. Is everything contaminated? Is everyone sick? That's one of the scary things about a pandemic. A viral pandemic is that other people become the threat.
10-4, 11 Young, update your 6-3, 11 Young.
11 Young, we just pulled up 84. We'll be going up with the ambulance. In certain call types, you just know they're sick and they're positive, and you're giving it the 100% disinfecting. But nothing's perfect, you know. Fear is natural, and it's part of being human, and learning how to manage your fear is a big part of being a first responder. Whether you're a police officer, a firefighter, a paramedic, or an EMT, you know, managing when you're in a tight situation or you need to perform, keeping a clear head, calm, professional demeanor. I am fairly confident that we're going to see our numbers go up as we relax social distancing and the stay-at-home quarantine. It just looks like where we're at in this entire pandemic, it's going to be a series of, rolling hills. We're going to have upticks and hit plateaus, and there's a lot of people who are sick out there, and we'll be coming for them when they call.
Three or 4 months ago, the economy was booming, everybody was going to work, people were going out to bars and restaurants, and everybody thought that it was going to be a great year. All of a sudden, a virus comes from no place, from nowhere. It's invisible, you can't see it, you can't touch it, and it completely disrupts everybody's life. There's a lesson here about how easily we can be dramatically disrupted by something that we don't even see or touch.
NYPD's showing up in force for Clappy Hour tonight. So every night here on 77th and Lex, in front of Lenox Hill Hospital, there's a big gathering for gratitude. Everyone comes out to show their appreciation for how hard everyone in the hospital is working.
Back for more. Who are we on? Ralphie.
The mounted units are a relatively new thing. It's so beautiful to see them come out and support us, both the officers on 2 legs and the officers on 4 legs. It's lovely to see everyone come by. It creates a real scene. People honking, clapping, cheering. And then everyone in the neighborhood coming out in their balconies, signs. It's beautiful to see.
It's an unbelievable outpouring of support by the general community who say thank you. In front of every facility, there are signs saying thank you, heroes. And they applaud. The fire engines of the fire departments all come. All the firemen stand on top of the fire engines, and everybody stands around the hospital clapping.
It's an amazing feeling. It's kind of weird because we're not used to that, and we're the givers, and I like to help people and give. So it's a different kind of feeling, but it's greatly appreciated, and I understand that people want to do something, and we love it. Hero event was unbelievable. Like I said, they're the heroes. We're not used to being the heroes. We're used to the first responding being the heroes, and I still believe they are the heroes.
There are times where I certainly feel like one. There are moments, they're usually private, they're usually with my partner, and my partner knows, and I know what my partner did. And it's those little moves, those little moments on a hot job that no one knows. It's just between you and your partner during an emergency response.
Our military's ability to move at a moment's notice and shift directions, their ability to adapt and overcome, made me extremely proud because I served, but also reassured me that there's really nothing that we cannot fight together, that we will combat this and we will win this fight.
This is what happens, I think, in a crisis situation. People, despite their politics, despite their partisanship, despite their economic circumstance in life, despite where they come from, despite religion or ethnic differences, people band together in the crisis.
We're a very strong city, we're a strong community, so I know that we will recover, we'll heal together, and we'll come out hopefully a little bit better on the other side of this, closer and a little bit more aware of how fragile life can truly be.
This will pass. Eventually, we'll come out of this stronger, more united. We know that it's going to end. And at least right now, we do see a little light at the end of the tunnel. And it's been a long, dark tunnel.
It gives me a lot of hope to see people come together during times of hardship. New York City is my hometown. We have always pulled through, and you know, you don't bet against New York. The way we come together. We might be rough around the edges, we might have a lot of attitude and some messed up accents, but we are formidable city, and we're gonna win. One in 6 people are out of work overnight, in a couple weeks. You know, people have depression when times are good, and when things are really bleak and difficult, people who are struggling are you know, gonna have an even tougher time. Yeah, I mean, it can get pretty dark out here sometimes after a tough call. You know, you gotta definitely listen to good music. Nothing lifts spirits like music. It's a universal language.
This goes out to all the people out there in the military who put their lives in danger, and all the healthcare professionals out there, everyone who's on the front lines. There are so many of you out there, and I just want to thank you for your service as well.
Where did all the people go? And they got scared when the lights went low.
Every day, it's so annoying. It's just because I was in the hospital, I don't know what's contaminated, what's not contaminated. Hey, guys.
Hi, guys. I'm home.
So my question is, how does it make you feel to be appreciated?
So it's a good question. So it's a little overwhelming. It's a beautiful thing, and we really appreciate it. My 9-year-old said it perfectly. Is when she said, she's like, "Mom, you do this every day. Why are people all, you know, saluting you and saying you're heroes now when you're a hero every day?" Which is very sweet, and
That's really sweet.
It is.
I know you don't believe it, but I said it, and I still mean it. When you heard what I told you, when you get worried, I'll be a soldier.
What are hope puddles, and how is that helping?
So I created Hope Puddles at the start of this about 2 months ago. And it's really just a simple way to spread positivity throughout the hospital.
You find them underneath the stairs. People hiding everywhere. and be still as a stone.
How does one stay positive through this?
It's a good question. Really good music, played really loudly. It's always a good stress reliever. Sometimes we blast some good tunes in the ambulance, drown out the sirens. I run, I try and surf when I can.
Don't believe it, but I said it, and I still mean it.
Aaron Mendel, thank you very much. Well, you're a hero to me, and I thank you for talking, and I appreciate the work that you're doing.
Thank you, Quest. Keep spinning magic, man. We love you. Thank you.
I will. Okay. All right. Let's get back to the magic.
I'll try forever. I'm never gonna say surrender.
How does it make you feel, you hero?
Look, I am an introvert at heart. I never do stuff like this.
What do your kids think of all of this, but especially you?
I don't know. Why don't I call them in and have them answer this one? Guys, the question is, what do you guys think of me?
Wow, you have so many kids. You're all so beautiful and handsome. Thank you. Okay, so kids, do you agree with me? Do you think that your father is a hero?
Yes.
He likes to say that he's not, like when we talk about it, like he's like, I'm not a hero, and I'm like, then who is? And he just can't come up with an answer, so I'm like, then you are.
I mean, he's the one that's out there, like, doing stuff, like, for the country and, like, for us, so, like, I would consider that a hero.
I mean, the thing is, everyone's really a hero. He's just someone who's proved it by doing stuff.
Na, 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 na.